LGBTQ 1 Minute News. Let's queer up HIV and health. Chicago hosts Biomedical HIV Prevention Summit. A major national gathering focused on HIV prevention is set for April 8th to the 10th, 2026 in Chicago, as the National Minority AIDS Council, otherwise known as NMAC, hosts its 10th Biomedical HIV Prevention Summit. Launched in 2016, the summit advances PrEP access for communities most impacted by HIV and remains the nation's only convening event dedicated to translating complex scientific discoveries into effective healthcare delivery. Marking its 10th year, the summit expands to its focus to a syndemic, whole-person approach, integrating the broader clinical and public health workforce. The 2026 theme, the Syndemic Approach, Strengthening the HIV and Public Health Workforce, highlights collaboration across clinical and community sectors to improve outcomes in communities most affected by HIV and broader health disparities. I get to be lucky, and I will be presenting the discussion on white coats in the community, how a physician-led outreach reinforces trust, equity, and engagement in HIV prevention at the summit on April 9th at 4:15. I'm really excited about this. I was asked what topic I would want to present, and obviously what we've done with Holy Cross Health and with Dr. Sievers out of the clinic in Wilton Manors. And, you know, we talk about the white coat syndrome, how people get nervous about that, right?
Blood pressure goes through the roof.
So the idea is bringing a doctor in the community at community events and things like that humanizes our doctors. They're not in the white coats anymore, and it makes it easier for patients when they come into the clinics. So that's kind of what the talk's about.
Well, they're lucky to have you as a presenter.
Yeah.
They love the way they worked the Chicago flag and logo. Nice work.
Yeah.
So maybe it's just my ADHD, but what does syndemic mean? Was that explained? What are you?
Well, syndemic is looking at the whole
like
approach. Right.
But does syndemic stand for syndrome? Like, I'm just not 100% sure what the syndemic mean. I know.
Google it.
I'm gonna Google it. I'm
that.
gonna do that with the old Google machine.
You still have one of those?
Yeah.
Wow, okay.
Yeah, I do.
What I really like about this, aside from the fact that you're going to be presenting at it, and that's awesome, is that it also seems to reinforce cultural competency, so that even if you have a straight doctor, they can learn and be able to treat their LGBTQ patients.
Right.
Because I think that's half the battle sometimes for people, right?
Right, absolutely. And it's just a great way. This is the 4th conference I've been to with them. And they also do the one at the USHA in the fall. So NMAC runs both of those programs. One's for treatment, one's for prevention. And so it really gets the idea of getting those communities together and getting the newest information out there and learning from other communities what's working and not working in those communities.
I love my straight doctor. I tell him all about my escapades and he goes, Brian, more power to you. I love that for you. And I say, I love that for me too. So anyway, let's hear it for straight doctors. So.
Well, that is an LGBTQ 1 Minute news story. There is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by sharing them and subscribing to Queer News Tonight.